Hey, everybody. Welcome to the call to Wednesday Wellness. Excited to be here with you all tonight. I'm excited also for you to get a chance to learn and to hear some amazing stories and to maybe understand why we're seeing what we're seeing with collagen. We've been doing this Wednesday Wellness now for, man, pushing almost a year, and just love the camaraderie we get and the information that's sent out so we can help a lot of other people. So I'm Dr. Brett Brimhall. I practice in the Phoenix, Arizona area. I'm a chiropractor by license. We have a couple of special guests on tonight, and I'm going to bring one of them on right away because what we're doing, the topic of this is collagen more than skin deep. And the reason why we are calling it that, because we want people to understand why people are seeing the results they are with the true science liquid collagen, and to make sure that people are getting the full benefit from it. And for maybe people that wouldn't think about collagen for something that might be helpful for what they're looking for, that they understand how to use it better for them. Okay. So with that, I'm going to have Dr. John hop on with us, and I want him to kind of share a little bit who he is and his story of what he's, kind of how he came to LifeVantage, but also like what he's noticed after adding the collagen specifically. John's a chiropractor, and he's got several practices. And I want to kind of, like him and me both, many people bring us products, and a lot of times we just, don't think they're that special, but this has had a life-changing effect on him and personally, and I want to kind of share that story. So John, are you there?
Yes. Hi there. Can you hear me okay?
Perfect. So
Perfect.
thanks
All right.
again for hopping on. And yeah, I'd love to kind of give a little bit of your background, and just also like what you personally seen with the collagen.
Sure. Well, like Dr. Brett said, I'm a chiropractor by trade. I'm going on my 19th year. Been practicing in beautiful North Dakota, especially it's beautiful in the summertime. I've own and operate 3 different clinics, have a few different chiropractors working with me, and treating everybody in the Northeast North Dakota. So I first was introduced to LifeVantage and some of their products back in 2012. And so maybe I'll start my story from a little bit back into the beginning and then lead up to the collagen, because this I think is pretty extraordinary for myself to have my own experience with these products. A lot of times when we're treating people, like you, Dr. Brett, sometimes obviously we don't go through all the same symptoms and have the same conditions as people we see. And when I first was introduced to activation back in 2012, I started the product more as a wellness, from a wellness point of view. I'm looking at, having a quality life, wanted to stay healthy. I was in really good shape back 11 years ago. Very active, had the young children, running around with them, and then starting my practices. So very, very busy. And a few years later, after getting introduced to this product, taking it for several years, I actually went through my own injury in my back, and I herniated a disc.
So
And,
John, real quick. So what were you taking at that time? Just so they know, 'cause you're being preventatively taking, what was that?
yep, Protandim NRF2.
Okay.
So I've been taking that for over 11 years. I don't miss a day. I get a little anxious if I do miss a day. I'll tell you that. I have not gone off of it since. When we first were introduced to that product, I had never heard anything about it. We learned about oxidative stress in school, but didn't know about the product, didn't know about that research. And obviously in 11 years, the research has sure grown. So I was on that product for a long period of time. Like I said, more as a preventative or wellness point of view. But when I injured my back, I have a lot of compassion, and I feel for people now that go through back pain, because it is debilitating, right? 90% or more of the population goes through back pain at some point in their lifetime. And so I had my own experience with it. And just a little history on what I was feeling at that point, and some of you maybe can relate, but I had pain from my back shooting down into my leg, into my calf muscle. If I would sit down, in about 2 seconds, it felt like somebody was taking a vice grip and squeezing my calf muscle, and they wouldn't let go. The only way I could get that pain to go away is by getting up and moving around. So when I started having this pain, I was struggling. I mean, I could not sit down at work. I couldn't bend, obviously couldn't sit. Sleeping was disturbed because I was in so much pain at night. I had to roll out of bed to the floor to get up, to get moving. And at one point I'm sitting here going, I didn't want to do any surgery, or I was trying to do the conservative approach as much as I could. I really wanted to go that route as much as I could. But I got to a point, and I knew the neurosurgeon. I texted him and I said, I might have to come see you. And he was going to set me up with an appointment, and I chickened out and I just held on. But I was going through so much pain and anguish. I got to a point where I thought, man, I don't know if I'm going to be able to work anymore. Right. I mean, it was physically exhausting and mentally exhausting. I mean, and I can see where people in chronic pain go through some sort of depression over time, because it really, it challenges you mentally. And I went on with this pain for several months. I mean, I remember driving to my in-laws 5 hours away, laying down in the car because I could not sit up. And my father-in-law set up a little traction unit in his barn outside so I could hang from it just to try to get some relief in my back. I mean, I struggled for a long period of time. I would have flare-ups occasionally as this time went on. And at some point, I actually got the pain to go down, to a degree. I would always have some sort of back pain and leg pain every single day. I would feel it. I had to quit running. I had to quit. I really like to run. I would run several times a week, but I had to kind of quit doing that because my back and my leg would hurt so bad. I also, I used to play hockey with my kids. Had to stop doing that. And so really, you sit there and say, "Man, is this what the rest of my life is going to be like?" Right? And last year in July, when True Science Liquid Collagen came out, I've never taken a collagen product before. I knew about it, but I thought, I'm going to give this a go. I know a lot of people are seeing a lot of outside results on their skin, and the results were happening quite fast for people. And I started taking it July, August, and I would say probably about end of August, early September. I was sitting there in my office and walking around, and I told my office manager, I said, I don't feel my back or my leg, which is odd because I would typically feel this every single day. And I said, I don't feel that pain. And then it got me thinking, okay, if I don't feel the pain, I'm going to try to go running, right, and see if I can run without, having any problems, right? Not the best thing to do, I know, but I really loved running, and I could only make it about 10 minutes, and I had to stop because of my leg. So I went running once, made it a couple miles. I thought, okay, next day, nothing. Still, I thought I'm going to go again. No problems. I could make it 2-3 miles, no leg or back pain. And now going on over a year of being on this True Science Liquid Collagen, I haven't had any back or leg pain. Let me rephrase that. I don't have daily leg or back pain like I used to have. I might have some stiffness, but nothing the way I had it before. And I find it amazing. And when you look at collagen, right, it's the most abundant protein we have in our body. Discs are made up of about 60 to 70% of the collagen. So all I can think of is that my disc being, that it shrunk a little bit as it herniated. What's happening is the True Science Liquid Collagen is not only replenishing my levels, it's telling my body to, produce more collagen, but it's actually so what that's doing, it's letting that buoyancy or that cushion stay fairly thick and maintain it. And I wish I could look under a microscope or maybe even ultrasound and look at that, because it'd be quite interesting to see what's happening. But super impressed with that. The only thing I can think of is the combination, and the more I'm learning as I go here, the combination of the NERV2 reducing the oxidative stress to the cell, and the combination of collagen and maintaining those levels has really helped reduce stress in my back. It's brought my pain more to a balanced kind of feeling, if that makes sense. But superior feeling, and I can't express it much more than that I tell everybody about this, because if I can help somebody like me, which I see a lot of in my practice, a lot of back pain, this has been remarkable.
So let me ask a couple of questions. So you're doing NERV2 activation for years up to this, right? And so you were doing things preventative all the time. And then you had the injury to your spine. And how long had that been going on before you started the liquid collagen?
Oh, I would say 3 years, 3 or 4 years.
Okay, 3 or 4 years. So, and then when you started the liquid collagen, you took it really for how long until you all of a sudden didn't notice your back, I should say?
Yeah, I would say 2 months.
Okay.
It was quite fast.
Which really, in perspective, right, that's super fast. But I love the fact what you said, like there's so many things you're having to modify in your life. from, you know, being active with your kids to even be able to do something you love, which was run. And I do also love the fact that once you didn't feel your back, you went running, even though you probably should, right?
Right, I know.
To challenge that. But I love the fact that what you know, so even though you weren't necessarily taking it for any reason other than, hey, I'm seeing these results with other people, you probably didn't expect that to happen with your spine.
Right, I didn't.
Right. And so we'll kind of talk about why that is, but the importance of what we have our hands on when it comes to the collagen and what it's doing for us on the inside. Yeah, great. It's great that we can see it on the outside, but what it can do for us on the inside, we're not always going to feel it in a week or a month, right? The deeper the tissue, the more problems in that area, the longer it might take for us to feel it. So just so you know, like the one thing I love about activation is whether you feel it or not, it's working. Like whether you feel it or not, it's working. We just need to be with it, take it long enough so we can experience it. So, hey, love that. It's awesome. I love that also you're using that to share with other people. So I know you have a good friend on here, Erin, and I'm just going to kind of key her up and have her share what her experience has been.
Yeah, Erin is a phenomenal person. I've gotten to know her the last few months, and there she is. She loves flying. I know she flew to Colorado today. So I'm sure she's coming down from that flight, right, Erin? But Erin is a mother of 4, married to a hilarious husband, John. And she is a certified nurse practitioner in dermatology. And she has one of the most remarkable stories that I've ever heard. And so, Erin, I'm going to let you explain your story to everybody and kind of share a little bit about your story with collagen and NRF2.
Sure. So I am new to the LifeVantage game. I have never done network marketing before. I'm going to be honest with you. I always kind of shied away from the mid-level marketing. There's a stigma with it. We all know it. And so I always shied away from it. But the NRF2 is something that always intrigued me. I have systemic lupus. This in no way has cured me. I will always have lupus, but it's made my quality of life so much better. I remember my Mayo rheumatologist bringing up the NRF2. Instead, I ended up going loads of immunosuppressants that were, I'm only in my 30s. I mean, I was getting very sick. It was putting me in the hospital. My pregnancies were very dangerous, on blood thinners, all the whole world with this lupus. So it's just been a battle. The NRF2, I always kept in the back of my mind, but I'm like, how good can it be? It's not like one of these big, powerful immunosuppressants. So then when the collagen came out, my good friend, Amy Shimmick, who I work with, she's like, I feel like anything she touches in life turns into gold. So she's like, oh, I just started with this LifeVantage and this collagen is so amazing. So I was like, oh, okay. So I signed on it as a consultant that day, and I didn't know if I would sell it. I just knew that I wanted to try the products, especially because the NRF2 is part of it. So when I started the products, I started on the Healthy Glow stack. So I can't say for sure what has helped with what. I'm sure synergistically together, they both have helped. But I know that within a week, I was having trouble gripping my coffee cup. I was having trouble getting my child out of the crib. I was having to change how I would do biopsies. When I would do a shape biopsy and put the past specimen into the cup, I would get trigger finger. I was struggling, and I was hiding how much I was struggling. I run half marathons. I run daily, like on the regular, and I was fighting through it. And part of me, I think I was fighting through it to prove to myself that I could do it, and that I was tough. And it got to a point where once I started the collagen and once I started the NRF2, I was enjoying it more. I was still doing it and still loving running, but I was enjoying it more because I wasn't suffering the aftermath of the joint pain that I experienced after the long distance run. So with the collagen specifically, having lupus, I was on a lot of medicines that just kind of destroyed my body. I lost a majority of my hair, which is really depressing for a lady. That's a big deal. And it was coming out in clumps. I found myself not wanting to brush my hair. I would cry and make my husband get the hair out of the tub because I didn't even want to see it. So it was really emotional. So once I started the collagen, I would say within 3 months, I was noticing huge tufts of hair growth. And I had never had hair growth like that before with my lupus, because I've had it since I was 20 is when I was first diagnosed. The other thing with the collagen, the exercise recovery. So like the workout recovery, I feel like the next day I'm not bogged down. Like if I wanted to go for a long run the next day, I can. So that I've noticed a huge difference with. Obviously the cosmetic improvements are amazing, but it really is beyond the skin. And I think until people try it, they're not going to realize, and you definitely get what you pay for with this collagen, because it's outstanding.
Wow. That's amazing. Like, I love what you shared. Like, you have how many children? 4, right?
I have 4. Yep.
What have you noticed that you can do now with them that you were having a hard time with before?
So, like I said, I tough through it. So I would do things. I do still do the same things, but I just, like I said, can enjoy them more. I'm in the moment more. There were times where I would work a full day and I would go to bed at 7 at night. And that's what I could do. I was done, physically, I was done for the day. In the morning, just so that I could maintain my high level of energy that I have to have with my job. I'm like a go-getter. I see a million patients a day, taking care of all these children, taking care of the house, everything in life. I would get up an hour and a half before work and have to like undo my hands. I would have to take a bath at 4:30 in the morning, just so that I could get to a level of functioning to start a normal day with all the medicines I was on. So that's how bad it was.
Just out of curiosity, has your medication dosage changed at all?
Yes. So I am a stubborn mule and I am off of my immunosuppressants. I had to be, because they darn near killed me. I got cytomegalovirus and it was horrible. So pancytopenia, for those of you that know, like my white counts, everything was terrible. So cytomegalovirus is one of those viruses like mono that it remains dormant. And so it can, if you are back on the immunosuppressants that maybe caused it, it can remain dormant and then resurface. So I have been off immunosuppressants. So that was kind of my panic moment, like, holy, I can't curse on here, but SHIT, what do I need to do? I need to find something, because I can't go back on these drugs, right? So that's when the NRF2 and LifeVantage with my colleague Amy Shimmick, it fell on my lap right after that. Yeah. But I've been able to get off prednisone. Wow. And that was the big one. I have been on prednisone since I was 20 years old. I remember my rheumatologist, I had bought in my wedding dress and he said, "You're going to gain 100 pounds. And I remember like, I was like, I just bought my wedding dress. There's no way. I remember crying every time I took my prednisone in the morning. And then of course I'm like, no, I'm not. So that I ran like 5 miles a day to prove I'm wrong, but I'm finally off the prednisone. I am still on, some of the maintenance medicines. And like I said, it's not cured my lupus. I'm still need to be on medicines. I still have horrific flares, but the severity of my flares, the longevity of the flares has improved significantly. Wow.
Hey, I know you're busy and you've been flying, but thank you so much for taking time to share your experience with us and that we can all learn from. And I'm grateful that you're feeling that much better. And I definitely no coincidence that when you're looking for an answer that your friend called you up and say, hey, and it just kind of fell in your lap. It was meant to be. So thank you for taking your time to share this with us. Awesome.
Thank you.
So guys, I'm going to try to shed a little light on why this is happening, because I know, like Dr. John, myself, many others, when the collagen was being released, like we didn't anticipate having these type of stories. Like it wasn't something that was like really something we considered, because most people, when they think about, collagen, they think about skin, hair, and nails. So I'm gonna share something with you guys just so you can see a couple pictures. And then we'll come back together and I'll kind of share a couple things. All right. So just from perspective, just so you know, collagen is everywhere in your body. All right. So if you aren't getting collagen, these areas, so I want you to, when you look at this picture, do you have any of these tissues in your body? Is there anybody you know that have these tissues in their body? And are these tissues functioning as optimally as they want to? Right. So for instance, like Dr. John, and go back to disc, right? So there's collagen in all these different tissue structures. So if you're not as flexible as you used to be, if you feel like you're aging faster than you want to, if you feel like you're just not as fluid as, or recovery after exercise is not as good as you want, or if you're like me, that's just, want to be active, play, sports against my kids, are you able to perform at the level that you want to? If you're not getting collagen in your diet, you're not getting it. All right. And so high quality sources of collagen come from the skin of fish, right? And bone marrow, right? So unless you're eating those things consistently, and maybe there's some plants and stuff that have collagen, well, you're probably not getting the quantities that you need. Okay. And even if you're eating them, are you absorbing them, and are they activated? All right. So let me just there's another picture for you. But the liquid collagen, the reason why it's different is for 3 reasons. All right, it's different for 3 reasons. It's different, number 1, because it's a liquid. All right, and because it's a liquid, your absorbability, and it's a peptide, it means it's broken into small components, you can absorb it. If you cannot absorb it, it cannot be utilized. All right, so when you think about taking a collagen that's not broken down into small particles versus a liquid peptide that's broken into really small particles, you have to take a much higher concentration of something that's bigger to break it down to even get enough. So that's a big deal. So even for instance, individuals that maybe have problems with digesting protein, which collagen is a protein, and you know who you are, you eat protein and you feel gassy, you feel bloated, you feel full. Or for some people, they eat protein, their bodies hurt. That's what you see in autoimmunities. So to have a collagen protein broke down this small, you can absorb at a high level without reacting to it. That is a giant deal, because 35% of you is collagen. So the quality of your body is a result of the quality of the collagen you are consuming and absorbing. All right. So activation replenishes and maintains. The activation part is, if you're not familiar with activation is the process of getting your body to do what it's designed to do when it was younger. It turned on the body's ability to basically manufacture the collagen. All right. So most people think of supplementation. So when you talk about activate, replenishing is what most people think about when in terms of basically supplementing. So most collagens, or most even supplements out there, are supplementing deficiency. So the way I look at it this way, I have 4 children. I don't want to supplement their income forever. Like, I want them to be activated. I want them to have the knowledge, the skills, and the confidence that they can provide for themselves. So your cells have the ability to activate if the ovens are turned on, if the systems are turned on, and if they have the right materials to use that. So this really red quinoa is basically the electricity to the cell to turn the actual production of collagen on. And then that fish collagen peptide, we talk about the liquid, and then there's berry and fruit extracts in it. That what this does, it actually helps protect the bonds. Okay. All right. So let me show you this picture here. Hopefully my other picture. There's 10 types of collagen, right, in this liquid collagen. So look at that list real quick and think about, okay, so when people are saying, well, what might this benefit? These are the collagens that are in liquid collagen. So if you're struggling in one of these areas, that type of collagen is needed for that area to function at its peak. So if it's, skin or teeth or eye or heart, brain, liver, lung, like those types of collagen are in this product, so your body can then utilize it to help improve the functionality of that system. All right, because here's the problem. In medicine, we wait for a problem to fix a problem. The body doesn't do that. The body does not wait. Before it ever copies a new cell, it goes through and tries to correct the damage before a new cell is being produced. You don't want to produce a bad cell. So we need a shift to be pro. Like Dr. John, he was taking the collagen specifically because of, and he was taking the protein nerve too, because he just wanted to age gracefully. He wanted to feel and perform at his best, right? He didn't want to have a problem, right? That's why we need to shift our mentality. So to me, the collagen is much bigger than the activation of what we do with the product is much bigger than waiting for a problem or trying to fix a problem. It's great that when your body starts getting what it needs, it repairs things and we function at a higher level. That's awesome, but we need to be more proactive. All right, let me show you a picture here. Let's say a picture is worth 1,000 words. Okay, so this picture is not a real picture. Let me tell you that up front. When I stole off the internet, okay, you can see the process of collagen breakdown in people's skin if you look at them. You can't see that in a blood vessel. You can't see that in the liver. You can't see that in the kidney. You can see it and you can feel it in their activity level, in their happiness, in their ability to recover. Like that's what you're noticing, their functions. Upper slide is a picture of the collagen density in 8 weeks from what it was to what it was 8 weeks later with the True Science Liquid Collagen. The density improved. So what people might see in their skin, they might see that shift. All right. So I'm going to show you, I'm going to tell you a couple quick stories of people I personally know. All right. This is a friend of mine that I ran into her at a sporting game. So whoever you can find it like that, see if you can mute them. This is a friend of mine. She was in the process of, she broke her hip and she was going through cancer treatment. So with cancer treatment, she had beautiful hair, all fell out. She came to my office because she could barely walk, barely move. I said, you don't have a choice. You got to come to my office. She wasn't a patient at the time. I said, you don't have a choice. She's kind of an adopted grandma to my kids. And I said, you got to be in. So we started her with activation. We started doing what's called a trisynergizer, which part of that's the NERV2 activator. And when the liquid collagen came out, I said, you need to start it immediately. Yeah, this is 4 weeks. Right? 4 weeks difference. Okay. But keep in mind, when someone goes through chemo and radiation, they're exhausted. They hurt all the lose their hair, but they just feel horrible. Right? She could barely walk, barely move. She just, she walked like an old lady. That's what she said. I just feel so old. Wasn't sleeping good. Didn't have energy. All right. This was another month later. Right? You see where her eyelashes and eyebrows started coming back in. So I think every time I see this is, okay, what else was going on the inside? Right? Fast forward. That's from day 1 to 3 months. Right. But the coolest thing that happened with her, she went from somebody that she just had a hard time moving and walking. She could kind of function, like walk to the mailbox and back, to somebody that was now walking 3 miles a day, being super active and productive. And mind you, she had just come off chemo 4 months previous. Right. So her body was in a very speed up state.
Ang haba ng tulog.
You guys see who this is?
Ganito.
Bakit?
So I can find out who's doing that talking to me.
So Sophia M.
Sophia.
There's saying Sophia.
Perfect. Thank you. Okay. Let me show you one other picture. Another client of mine. Okay. Now we had her doing NERV2 activation. And when she came in to see me, she came in because she had a real hard time losing weight. She's hurting all the time, had headaches all the time. And here's the crazy thing. If you take 30 people all have headaches, they might have headaches for different reasons. But at the foundation, if you can address how the body makes energy and clean up and repairs, you can improve a lot of how the body functions. So day 1, right? We started on the collagen, and you'll see her eyelashes and eyebrows come in, but look at the color of her eyes. Right? This was in a matter of 3 months. And so her diagnosis is basically she had a thyroid issue where basically she lost all of her eyelashes and eyebrows. But she was tired all the time, felt sad all the time, got overwhelmed very easily, and she just struggled physically, right? This is what happened with activation. And so if activation is a new thing to you, and I'm not going to spoil the thing, but what I want you guys to know that LifeVantage, as a publicly traded company, they have a patent pending now on the NERV2 and the collagen and how they work together. Now I'm not going to, you'll get to hear about that next month, but the bottom line is the reason why we're seeing things that we're seeing, like you heard about tonight, is because your body has the capacity and desire to heal at the highest level it possibly can. The potential of your body to heal, we don't even really understand, but it can only repair to the point of the way in which the switches are turned on in the right way, and the things that we give it to do its job. If it does not have that, if the switches aren't turned on, right, and the body doesn't have what it needs to do its job, it cannot heal at the level that it wants to. Now, the really cool thing about listening to Dr. John's story, you guys, low back injuries like that are very difficult, and typically they just get kind of worse with time, and they get less functionality. Right, here's a guy that's highly focused on what he does, and he was bad advertising. Right, but when the collagen came in, just like him and me both, probably like, I don't know what I don't really expect it to do anything. I don't really care about necessarily aging, like how I look, but I really, really care about how I perform and how I function. All right. So what we have our hands on is this is a lot bigger deal than we realize. So if you're somebody that wants to be proactive and you don't have any problems, you just want to age gracefully, in my opinion, doing the Nerf 2 and the collagen is a game changer. If you're somebody that, hey, you know what, like I don't feel good and I want to feel good, well, 35% of you is protein, right? So of collagen. So if you're not taking this, and people, one thing I'll kind of throw out there. So the dose that is in the bottle is the dose that's recommended based on the studies. All right. You need to, whatever you need to do to keep your budget the way you want it to be, great. I would much rather take a half a dose of this collagen than a full dose of one that's not going to work, if you need to make it last longer. Now, your results are not going to happen as fast, but you need to understand, like the most expensive supplement or thing that you do is the one that doesn't work. Super, super good. So, Dr. John, I want to see if there's anything else you want to add, and then before they kick us off.
You covered it, Brett. Like usual, that's great. I would say that I just kind of say the same things. You can't go to the gym one time and get in shape, right? And it's the same with activation. You can't just take it once and expect the results. You got to give it time. And the dose that they've done with the studies, from what I'm hearing, is pretty phenomenal. And I think everybody in the next few months here, when they start hearing what's coming, it's exciting stuff. But it explains exactly what I went through with my back and with the Nerf 2 and adding the collagen. So complete game changer, and it's life altering for me. To not have pain on a regular basis is amazing. So there's always hope.
Yeah, for sure. But and Aaron, thank you so much for sharing your story. And what you got to understand, no matter what your diagnosis is or what you're hoping to see change, your body only cares about what's most important to it. So even though you may want a certain thing to change, if you're feeling something, it may not be the biggest problem that your internal body is worried about. So what we're doing with activation is we're supporting the body's natural switches to be able to perform at its best, and supplying it with science-backed products and technology to allow the body to perform as designed to perform. So no matter what your hope is, if you're not doing this, to me, it's an absolute must. But stick with it long enough, right? Because you didn't get where you are overnight, and it's not going to get where you want it to be overnight. But you will definitely not get any better than you currently are unless you do something different. All right. So great. Thanks for everybody for being on here. Thanks, John. Thanks, Aaron. I'm super excited to continue to hear more about the stories, and we'll see you guys next Wednesday Wellness. See you, John.